4.9% of all cases. They remain predominant, followed by BA.2, which is 7%, and BA.4, 4.8%. There were also XQ.1 and other subvariants. At the end of week 42, that is like the week ending the 23rd of October, there was a small decreasing trend. And the predominant strain was BA.4 or 5, accounting for 97.6%. In the UK, over the past week, there was an increase in the number of cases, but the upward trend is slowing down, and the dominant strain is BA.5, accounting for 87.4%. In the US, there's a slight increase, and the daily fluctuation is quite significant. The dominant strain has changed from BA.4 to other subvariants, including BQ.1 and BQ.1.1 and also BF.7, which have become more common recently. But the dominant strain is still BA.5, which account for about 39%. In New Zealand, there is a downward trend, and BA.5 is still the dominant strain. Over the past week, new variants were detected, including BQ.1.1 and other subvariants. There has been a decreasing trend for XBB cases, but over the past few days, there were also XBB cases, and in Singapore, over 54% of the cases were XBB, and for BA.2.75, they account for 24%, and BA.5, 21%. As for whether XBB will lead to more severe cases, even though with an increase of XBB cases in Singapore, but there was no evidence showing that there were more serious cases. In summary, we realize that there's been a decrease in the number of local cases, but there's been a slight increase in the number of imported cases. We will continue to monitor COVID situation around the world, including subvariant cases. We will monitor whether there will be more subvariant cases in Hong Kong. Thank you. Over to Dr. Larry Lee. Good afternoon, everyone. The number of patients staying in the hospital is 1,950. There has been 210 cases every day over the past week. We have about 10% of young children below 3 years old who have received 2 doses of vaccination, which is not desirable. So starting from yesterday, 4 children vaccination community centers, including Hong Kong Children's Hospital Community Vaccination Center, will provide administration service for BioNTech. And I appeal to parents to take your children to get vaccinated soon, because unvaccinated children will have high risk of infection. And if infected with COVID, it could be serious, including complications, vaginitis, and also croup. And most serious cases, there could be fatalities, and also there could be middle and long-term complications. There were a few patients who were in ICU in Queen Elizabeth Hospital, who was a 31-month-old boy, and the boy is still in critical condition. Another 24-month-old baby girl who was in Queen Mary Hospital. She is now stable, and she suffers from croup. Another 21-month-old baby girl who was staying in Princess Margaret Hospital has now been discharged. We are also concerned about the seasonal influenza situation. We appeal to parents to take their children to get flu jab soon, so that they will not be exposed to the risk of being infected with both seasonal influenza and COVID. So it is recommended that parents take their children to get 2 doses of vaccination. That's all for my briefing today.
Over to the Undersecretary. Last week, we announced some relaxations to social distancing measures. The relaxations was supposed to take effect yesterday, so we don't see the effect just yet. But then we will be monitoring the situation over the next week to see how COVID goes. As the doctors just mentioned, things are optimistic in terms of the COVID situation. We will keep monitoring the situation for another week and see how it goes. The vaccination is the most important part of our COVID strategy. To reopen, vaccination will help us create a maximum degree of room for a return to normality. So I want to spend some time to talk about the vaccination arrangement. Scientific data and clinical data across the globe suggest that vaccination is effective and safe. Many countries have rolled out vaccination campaigns. There are more than 100 million doses that have been administered in Hong Kong. Vaccines will also become a regular part of our system here. Our overall vaccination rate for those triple jabbed, the percentage is around 80%. We thank the public for cooperating with us and getting jabbed. But for young children and the elderly, the vaccination rate is still on the low side. The government would like to roll out some measures to help people get vaccinated. We want to take targeted measures in fighting COVID. So for these two demographic groups being our priority groups, that will be following measures. For young children, apart from the vaccines, for those 6 months old, that is the CoronaVac, the Sinovac vaccine. Starting from yesterday, November the 2nd, we started offering vaccines for those suitable for the 5 to 11-month-year-olds. That is the BioNTech, the children's vaccine, the children's version of the BioNTech vaccine. Now, for those aged 5 to 11, they can get their shots at children's vaccination centers. In terms of the intervals between the two jabs, they are the same as what we had in the past. Now, for those aged 6 months to 5 years old, the government has purchased the toddler's version of BioNTech. The vaccines are being delivered. Hopefully, the vaccines will arrive tomorrow. But once we do have a finalized date, we will make an announcement. Now, for those aged 6 months to 5 years old, they have been given emergency approval for use. Next week, at children's community vaccination centers, the toddler's versions of the vaccines will be provided. We will also update our booking system so that once the date is finalized, and then we will make an announcement. But just a quick reminder here, for those aged 6 months to 5 years old, the child will still have to get 3 doses. For the interval between the first and second doses, it's 56 days, and for the interval between the second and third doses will be the 90 days. So please take your child aged 6 months to 5 years to get vaccinated as quickly as possible. Now, turning to seniors, I'm talking about people aged over 60 years old. Now, we try to boost the vaccination rate for this group. That is, we're talking about 3 jabs. 80% of them have received 3 jabs, but for those aged over 80, the rate stands at 60%. Learning from the experience we had in early this year, we stepped up our efforts in driving vaccination rate. The Health Bureau, Labor and Welfare Bureau, and the Social Welfare Department, care homes, and other sectors have taken part in an outreach vaccination campaign. During the outbreak in February and March, the vaccination rate at care homes was only 60%. That's the first dose. But then the rate went up to 95% by September. So the 3 jab rate is now at 80%. Now, more than 90% of those who passed away were those of an advanced age. 130 to 20 people passed away. By late August and early September, we had a mini outbreak. We once had 10,000 cases per day, but the death rate was at the low 2 digits. This suggests that vaccination helps lower the death rate. Our concern now is for seniors staying at home. For COVID cases confirmed at hospitals, seniors hospitalized tend to be those staying at home and then people who haven't got their jab. For the home vaccination campaign, we work with the Civil Service Bureau, the Home Affairs Department, and the property management firms. We rolled out a pilot scheme. We do home visits. We encourage seniors to get vaccinated. On September 17th and 18th, we visited Jiwanshan, Qihong Estate, and then on October 22nd, 23rd, we visited Wang Tai Xin, Kuntong, and Kuaiqing. We knocked on doors. We went from door to door. We explained the importance of vaccination to those aged over 70 and help them get vaccinated. We thank the community support. People are working together, looking out for one another, and make it through the COVID. We visited around 4,600 seniors. We persuaded them to get vaccinated if they were willing. We offered vaccination on the spot. But under two circumstances, now let's roughly only 200 seniors agree to get their jab. That's less than satisfactory. We will continue to work hard to persuade seniors to get vaccinated. If you have an elderly parent, visit them. If you have received their jabs, you're setting a good example for your elderly parents. If you're not sure whether your elderly parents are suitable to get a jab, consult a doctor to see if your elderly parent can get a shot. And also look out for the health conditions of your elderly parents. If they're not feeling well, take them to get tested and go take them to a doctor. Bring your elderly parents or your children to get a flu shot. Winter is coming. Through the flu shot, people will be at lower risk of catching flu during the flu season. The floor is now open to questions. Before putting your questions, please identify your media outlet. Please limit yourself to 2 questions each. On the left, the journalist in black. I'm from Hong Kong 01. The first question about Mr. Paul Chen. The press release from the Department of Health says that as long as this person is asymptomatic and with a high CT value, this person will no longer have to undergo isolation or be reissued with a red code. So what's the CT value? What's your threshold for people so that people don't have to get a red code? But for the Department of Health, how long would it take the Department of Health to tell whether a person has recovered? We will take this opportunity to clarify certain matters so that people will get a full picture, a better understanding of our COVID policy. In fighting COVID and in our return to normality, we have to work together. Now, I will invite Dr. Choi to provide a response to the questions raised by the journalist. Let me explain our border control measures. Now, for all overseas arrivals, they have to undertake an RT within 24 hours before boarding. They have to get a negative result. And then they have to fill out an online declaration of the test result before boarding, starting from June 1st this year. For those infected with COVID over the past 3 months, now they may have tested PCR positive. As you are aware, even for recovered people, they may have residual virus in their bodies for a while, even after recovery. So we have this measure in place for those who test PCR positive before boarding. These people can take an RT within 24 hours. If the result is negative, they can board a flight to Hong Kong. Starting from September 26th this year, we remove the requirement for a PCR test before boarding and replace that with an RT test instead. So for everyone, whether they had an infection in the past, they have to get a PCR test at the airport upon arrival. This is the test and go arrangement. They can return home or wait for the result at the hotel. If they test positive and indicated a previous infection in the past 3 months, we take a look at the information, including the test result, the date of infection, the time of recovery, especially whether this person has any symptoms at the moment. That's how we determine whether this is a case of a repositive case or whether this is a recovered person or a new infection case that requires follow-up. Once we arrive at a decision, if this is a new infection, we will issue an isolation order to this person and arrange for isolation accordingly. Starting from September 26th all the way up to the 1st of November, 455 travelers arrived at Hong Kong and they declared a prior COVID infection before boarding. They obtained a negative RT result. That's how they managed to get on the plane to Hong Kong. But then upon arriving at the airport, they tested PCR positive. These people were asymptomatic. After we looked at the information, we determined that these people were no longer contagious. So they did not have to undergo isolation and no red code was issued. But after arrival, they still had to undergo PCR testing on day 2, day 4, and day 6. And we determined that they were no longer contagious. This arrangement, in place since September the 26th, 455 people were subject to this arrangement. Now, there is similarity with our local cases. Now, for locally infected people, for those with a previous infection in the past 3 months, they are no longer subject to compulsory testing. Even for recovered people, they may have residual virus in the body and may be picked up as a positive case during testing. But for those people who do test positive, and we have to look at the result and when this person was previously infected. If we determine a person is a repositive case or a recovered case, this person will no longer have to undergo isolation or receive a red code. Now, I will not identify each particular case. I do not comment on such details. But then for all arrivals, including government officials, we apply the same standards in terms of public health.
Next question. The lady on the left. I'm from cable TV. You mentioned that there are different considerations for positive cases. Well, do you have a standard for the CT value to determine whether the case is recovered? Should it be more than 30 for the CT value? And you mentioned about the 455 people. How many of them is like FS who did not have to undergo isolation like Mr. Paul Chen? Are the requirements different for locally infected cases and imported cases? Because like FS, he did not have to undergo isolation for 7 days. Again, I will not comment on specific cases. But in terms of operation, a lot of Hong Kong people now may go out and travel abroad, and some of them may have been infected. Well, scientifically, as you know, that the PCR test for these people may show that there are residual virus in their bodies. So we have to look at the test results of all inbound travelers and pay attention to when they got infected. If there were previous infection cases, if there were positive cases, the CT value may be higher. But for new infection cases, when they have recovered, the CT value may be high, but they may not be as high as repositive cases. Well, for some of the cases, they may have some test result or certificates from doctors for our reference. So we really have to look at the test result of the inbound travelers upon arrival and make a decision. For some of the cases, they may test positive and they may be new infection cases, but they may have developed symptoms that worry us. So we will look at all the information in a holistic manner. As for different requirements or ways of handling of overseas travelers and local cases. I'm not going to comment on them. Currently, for imported cases, we pay particular attention to the test result at the airport that is on day 0 and also the test results on day 2, day 4, and day 6. We would pay attention to whether they are subvariant cases. Next question, the one on the back. I'm from Economic Times. I would like to ask about the CT value of the financial secretary and the CT value range for recovered cases. Also for imported cases and local cases. For example, if I get infected today, the CT value that I get for the next day may already fit into the range for recovered cases. So are there inconsistencies between the requirements between local and imported cases? Also, would like to know how many vaccines did you purchase recently, and also the progress for implementing 0+0 arrangement. Perhaps I will first respond to the social distancing or quarantine measures. For vaccines, including those who have been vaccinated, well, I don't have the relevant information at hand, so we don't have to take that into consideration when we purchase the vaccines. As for 0+0 arrangement, the last round of social distancing measures started implementing yesterday. We will look at the situation this week. If the situation goes well and if we see a decreasing trend, then there will be a bigger room for us to adjust or relax the social distancing measures. So we hope that we can successfully boost the vaccination rate so that there is more room for us to relax the social distancing measures. Well, I'm afraid that I would not be able to comment on specific cases or tell you the exact CT value of a specific infected person. But for requirements for inbound travelers, as mentioned, if they have been infected and they have a RAT negative test result, then they can enter Hong Kong. If we look at the 455 cases, some of them were recovered and they come back on their day 6, because as long as they get a RAT negative test result, they can enter Hong Kong. So we do see that there are positive PCR test results among these 400 inbound travelers. We'll take the next question. We'll take an English question.
Okay, about Financial Secretary Paul Chan testing positive on arrival, can you talk about the arrangement for recently recovered patients who fly into Hong Kong, and under what conditions should they be isolated? And why didn't Mr. Chan need to be isolated? Is there any preferential treatment for him? Thank you.
Okay, so actually I have responded in Cantonese, but I will repeat it in English for your questions. So I cannot comment on individual case or their testing results, but in general, all inbound travelers from overseas coming to Hong Kong must have a negative result of rapid antigen test RAT before they come to Hong Kong within 24 hours before their scheduled arrival time. And after they get a negative RAT results, they have to declare via our online health declaration form to declare whether they have symptoms or they have any past infection to us. So any inbound travelers since June 1st this year, if they are infected with COVID, maybe they will have residual PCR tested in the result. So we allowed they can come to Hong Kong with a negative RAT. And starting from 26th of September this year, we cancel the pre-departure PCR test and allow people come to Hong Kong with a negative RAT to Hong Kong. So anybody who arrives Hong Kong, the international airport must undergo a test and go arrangement and test the PCR in Hong Kong. So after they test the PCR, they will go back home or stay in the hotel for the result. So if the result come back to be positive for these recovered persons, and they have declared the recent infection with COVID, we will evaluate their status, including the history provided in the health declaration form when they got infected, and also the result of the PCR, and determine whether this case is a one recent infection, or second, a repositive case, or third, it is a recovered patient. So if we classify it as a recover or repositive case, we won't give them a isolation order or we'll give them a red code. So, but we will continue to monitor their day 2, day 4, and day 6 PCR tests as the ordinary inbound travelers. So indeed, from September 26 to November the 1st, there are 455 inbound travelers who declared a past infection of COVID within 3 months, and they are tested positive upon arrival. They are all asymptomatic. So we evaluate their result and also their history and also their past infection date. And we did not classify it as a recent infection. So they are classified as a recovered case and not contagious. So we follow up these cases on the day 2, day 4, and day 6 test results. So indeed, this arrangement is on par with the local arrangement for the local case. And if there's local citizens who are infected within 3 months and recovered, they are not bound to any compulsory tests in Hong Kong. So even if they are tested PCR positive, we will consider his past infection history and also all the results. And if they are classified as a repositive or recovered patient, we won't give them any isolation orders or red code. So indeed, this inbound port health arrangement is for all inbound travelers, including any citizens or government officials. Thank you.
咁頭先4位記者咧都問過財政司司長嘅個案啦，咁徐醫生都解答咗，咁會唔會有行？
Just then, some questions were all about the financial secretary. Would any journalists have any questions about other aspects of COVID? I'm from Now TV. First question. The Education Bureau said that they're trying to aim for 100% vaccination rate for students before scrapping the requirement of the daily RT test for students. To achieve 100% vaccination rate, how long is that going to take? Is it even possible to reach 100% vaccination rate for students? If school attendance is hinged on vaccination, do the authorities believe this will take a while before we get there? Now turning to recovered patients, what's the CT value range for recovered persons? When was this mechanism put in place? Is this in line with the discharge criteria set by the hospital authority? The financial secretary came back to Hong Kong without having to undergo quarantine. Did he have a red code or an amber code? First, address the point about the vaccination and RT for students. We have to make a distinction here. The vaccination is for protecting the people. Getting an RT is about protecting others. Now, if people test positive, they should stay away from school so that they don't infect other people. So, vaccination, protecting oneself, and RT, protecting others, those are two different concepts. We have to explain the importance of vaccination to teachers, parents, and students. Young people are the future of society. That's a good thing to give them an idea of public health. It's all about prevention. There are diseases that can be prevented. Now, for infectious diseases, it's a good idea to get vaccinations if it's available. Prevention is all about protecting oneself and protecting their family members and friends and their loved ones. That's something important for children to learn. It's also something in civic duty. If they don't protect themselves, they end up taking up public resources. And that means other people, maybe other children, may be denied healthcare services. So this is about building up the civic awareness and public health awareness for our next generation. Now, as for the point about CT value, I will invite Dr. Choi to give us a response. Now, I cannot comment on the details or color codes of individual cases. There's one thing I can say here. When was this arrangement put in place? Starting from June 1st this year, we have put in place this arrangement for recovered COVID patients. Even if they tested positive through PCR test overseas, they couldn't board a plane to Hong Kong. That's a hassle for travelers. As you're aware, PCR tests are highly sensitive, so even for recovered patients, they may test PCR positive. That's why we allowed people to take RT as an alternative to get on the plane, and then they can return to Hong Kong, and we follow up accordingly. Starting from September 26th, we removed the requirement for a pre-boarding PCR test. People could do an RT instead since September. So now I'm giving you the figure. Starting from September 26th, we've had 455 inbound travelers who tested PCR positive upon arrival, but then we found them to be no longer contagious after verification. We'll take the last two questions. Speakers are using a microphone. Now, I don't have the figures at hand, but we will give them enough time to achieve that. I would like to make an appeal to parents once again. The best way to protect your children is to take them to get vaccinated. There are 2 vaccines available to choose from. Get your children inoculated as early as possible, and also help them get a flu shot that will protect their children. We take the last 2 questions. The gentleman in the second last row and the lady on the right. I'm from RTHK. Without going into the specifics of individual cases, let's just stick to imported cases in general. Now, for those with previous infections, what's the range of CT value for these people to be considered recovered persons? Now, for those considered to be no longer contagious, do the authorities ask them to stay away from mask-off activities, including talking to people without a mask or staying away from meals with other people? I'll first talk about the point about mask-off activities and the question that was raised over and over. Mask-off activities. Can they take off the mask when they deliver a speech? Starting from June 16th, for those talking to a guest, people could take off their masks starting from September 26th, but there is a condition. They have to keep a distance of at least 1.5 meters, and people cannot share a microphone, and they also have to thoroughly clean and disinfect a microphone. So this policy has been in place before the incident. Now, I'll invite Dr. Choi to tell us more about recovered persons. For someone considered to be a recovered case or a repositive case, they are treated in the same as other inbound travelers, but there is always a risk with inbound travelers. The focus is on the testing at the airport on day 0, but there are also tests on day 2, day 4, and day 6. Some positive cases are picked up on those days. So before these positive cases are found, these were hidden cases. As we mentioned time and again, some cases are picked up on day 0. 50% of the cases are picked up in this case. On day 2, another 10 to 20% of the cases are picked up. We looked at the figure and realized that most cases are picked up in the first 3 days. So there are different arrangements for these people. So these people are asked not to go to high-risk places like restaurants. That's our practice. There's always a risk for inbound travelers. They may have got infected overseas. So we ask people to stay away from high-risk locations in the first few days upon their arrival. But then there's also the health surveillance. So that's different from someone, a local resident. I'm from Mingpao. The government used to put out a press release that people, those boarding a flight, have to show a recovery, proof of recovery from 14 to 90 days. When was this requirement removed? You mentioned cases who were recovered only 5 or 6 days before recovery. Does it mean that people can get on the plane as long as they have a recovery proved it, and it doesn't matter how many days it has been since they recovered? When weren't the cases of the 455 people announced? What's the range of CT value that defines a recovered person? For the 455 cases mentioned in the press release, how many tested positive afterwards?
嗱，我諗嗰個安排6月1號開始，我哋都有公佈到嘅嚇，我哋喺新聞稿都有公佈到咧呢一個安排。尤其是如果大家記得係特別針對住一啲早前感染咗，可能係檢測陽性翻唔到嚟嘅人士，我哋個安排嚟嘅嚇。咁我哋冇特別要話俾大家聽有幾多個呢個案，因為呢個案我哋界定為係一個冇風險，唔係一個確診個案嘛，所以唔係確診個案咧，亦都唔會我哋
identify them as positive cases. Well, these cases actually appear locally as well, because after we look at their infection history, we determined that there are not new infections. We did not classify them as recovered person. We did not disclose how many of these cases we get every day. Well, starting from the 26th of September, we have removed the PCR test requirement for the pre-flight test requirement. So anyone who had obtained a negative RAT test result could board the plane, but they'll have to tell us on the online declaration form whether they had been infected before. But they will be able to enter Hong Kong or come back as long as they got an RAT negative test result. Well, if the infection period was long, the CT value may be different. If the infection period was shorter, it could also affect the CT value as well. So we did not draw a specific line because each case is different. The day or when they were infected is different, and when they return is also different. And these are factors we consider when we consider whether they are recovered cases. And also, they may have different symptoms. I understand that you are concerned about a specific case, but I would like to let you know that we have been carrying out these measures all along, and we did not disclose the relevant information because we did not have analytic data for that. And all we want to tell you is that since the 26th of September, we have a total of 455 of these cases. I believe that you're concerned about the CT value. Well, if the number is 30 or 29.9 and 30 may be a big difference. But I hope you're aware that we have to consider the cases in a holistic manner. For a person who has never been infected, we're more concerned about these cases. Because even if we look at the CT values, we will not be able to predict the situation. But for those who have been infected, we see that there is a downward trend for their CT value. So there are different considerations. And that's why we didn't draw a line at the CT value, because we have to look at all the information as a whole when we make a decision. Thank you for attending the briefing today.